Hello everyone. This day, we will be discussing just all about contraceptives. What is contraceptives? Contraceptives is a way to prevent the pregnancy, the unwanted pregnancy, um, by just performing a method. There are two types of methods in contraceptives. The first one is the artificial method. We also have the natural method. Let me start with the artificial methods. These methods are oral contraceptives, transdermal patch, vaginal ring, subdermal implants, hormonal injections, intrauterine device, chemical barriers, diaphragm, cervical cap, male condoms, female condoms, and surgical methods. The first one in the artificial methods is the oral contraceptive or combined oral contraceptive pill. The combined oral contraceptive pill, often referred to as the birth control pill or colloquially as the pill, is a type of birth control that is designed to be taken orally by women. The pill contains two important hormones, progestin and estrogen. Some advantages of the pill include these following. It does not interrupt sex. It usually makes your bleeds regular, lighter, and less painful. It reduces your risk of cancer of the ovaries, womb, and colon. It can reduce symptoms of PMS or premenstrual syndrome. It can sometimes reduce acne. It may protect against pelvic inflammatory disease. And it may reduce the risk of fibroids, ovarian cysts, and non-cancerous breast disease. Oral contraceptive also may cause side effects. These are the following side effects of these oral contraceptives: nausea, vomiting, stomach cramps or bloating, diarrhea, constipation, gingivitis or swelling of the gum tissue, increased or decreased appetite, and weight gain or weight loss. Next is the transdermal contraceptive patches. Transdermal contraceptive patches are a highly effective form of estrogen-progestin contraception. Most individuals who desire a reversible, non-event-based method of contraception and who have no contraindication to use of estrogens or progestins can safely use this method. Unlike the combined oral contraceptive pill, the advantage of the contraceptive patch is you don't have to think about it every day. You only have to remember to change it once a week. While the disadvantage of it is it may be visible. It can cause skin irritation, itching, and soreness, and it doesn't protect you against STIs. So you may need to use condoms as well. And also, the side effects of the birth control patch may include this following: an increased risk of blood clotting problems, heart attack, stroke, liver cancer, gallbladder disease, and high blood pressure. Next is the vaginal ring or Nova ring. The vaginal ring is a small soft plastic ring that you place inside your vagina. It releases a continuous dose of hormones, estrogen, and progesterone into the bloodstream to prevent pregnancy. Birth control rings are a safe, simple, and convenient way to prevent pregnancy. The ring also has other benefits like reducing acne, making your periods lighter and more regular, and easing menstrual cramps. While the disadvantage of it is you may not feel comfortable inserting or removing it from your vagina. You may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. It may cause temporary side effects, such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood changes. The ring doesn't protect against STIs. Next is the subdermal implant contraceptive. The contraceptive implant is inserted beneath the skin of the upper arm. The implant releases a progestational hormone to prevent sperm from reaching the egg. The implant typically suppresses ovulation as well. You can have a contraceptive implant inserted during a visit to your healthcare provider's office. Advantages and disadvantages of the subdermal implant. The advantage of it is it works for 3 years. It doesn't interrupt sex. It's an option if you can't use estrogen-based contraception such as the combined contraceptive pill, contraceptive patch, or vaginal ring. It's safe to use while you're breastfeeding. While the disadvantage of the implant is irregular bleeding, aka spotting, especially in the first 6 to 12 months. But most people in the implant get lighter periods, or their period stops altogether while they have the implant. Other possible side effects that are not as common include headaches, breast pains, and nausea. The side effects of this subdermal implant are nausea, stomach cramping or bloating, dizziness, headache, breast tenderness, acne, hair loss, weight gain, and vaginal irritation or discharge may occur. Pain, bruising, numbness, infections, and scarring may occur at the site where the rod is placed. Next is the hormonal injection contraceptive, or Depo-Provera. Depo-Provera is a well-known brand name for medroxyprogesterone acetate, a contraceptive injection that contains the hormone progestin. Depo-Provera is given as an injection every 3 months. Depo-Provera typically suppresses ovulation, keeping your ovaries from releasing an egg. Among various benefits or advantage of Depo-Provera are the following: doesn't require daily action, eliminates the need to interrupt sex for contraception, decreases menstrual cramps and pain, lessen menstrual blood flow, and in some cases, stop menstruation. Decreases the last one is decreases the risk of endometrial cancer. While the disadvantage of it is cause headaches, nervousness, depression, acne, changes in appetite, weight gain, and excessive growth of facial and body hair. Most of the people on the shot have some changes in their periods, including bleeding more days than usual, spotting between periods or no periods. This is most common during the first year. Other possible side effects include nausea, weight gain, headaches, sore breasts, or even depression. Next is the intrauterine contraceptive device. An intrauterine device, also known as intrauterine contraceptive device or coil, is a small, often T-shaped birth control device that is inserted into the uterus to prevent pregnancy. IUDs are one form of long-acting reversible birth control. The advantage of the intrauterine device is it protects against pregnancy for 5 or 10 years, depending on the type. Once an IUD is fitted, it works straight away. Most people with a HIWOM can use it. There are no hormonal side effects, such as acne, headaches, or breast tenderness. While the disadvantage of a copper IUD of non-hormonal IUDs can make your periods heavier and cause cramping, especially in the first 3 to 6 months, and you may have some IUD cramps. When you first get your IUD, for many people, these side effects get better once your body gets used to the IUD. And the common IUD side effects include irregular bleeding for several months, lighter or shorter periods, or no periods at all. Symptoms of premenstrual syndrome or PMS, which include headaches, nausea, breast tenderness, and skin blemishes. Next is the chemical barriers contraception. Chemical barriers or spermicides are sperm-killing substances available as foams, creams, gels, films, or suppositories, which are often used in female contraception in conjunction with mechanical barriers and other devices. Spermicides are usually available without a prescription or medical examination. The advantages of using contraception or chemical contraception is they can lessen the pain of menstrual cramps, keep acne under control, and protect against certain cancers. But these also have a disadvantage, which include an increased risk of blood clots and a small increase in breast cancer risk. The common side effects of this chemical barrier includes menstrual changes or heavier bleeding, amenorrhea or oligomenorrhea, changes in weight, headaches, dizziness, nausea, and cardiovascular impacts. In addition, women may harbor fears of long-term effects of contraceptive use, such as infertility and childbirth complications. Next is a diaphragm contraception. A diaphragm contraception, or cup, is a barrier method of contraception. It fits inside your vagina and prevents sperm passing through the cervix or the entrance of your womb. The advantages of a diaphragm or cup is you only need to use a diaphragm or cup when you want to have sex. You can put it in at a convenient time before having sex, or use extra spermicide if you have it in for more than 3 hours. There are usually no serious associated health risks or side effects, while the disadvantages of this are doesn't prevent pregnancy as well as IUDs or hormonal forms of birth control. It prevents pregnancy only if you use it every time you have intercourse. The negative effects of diaphragms is most young women who use a diaphragm have no problems with it, but possible side effects include from the spermicide, irritation of the vagina and surrounding skin or an allergic reaction. Strong odors or vaginal discharge if the diaphragm is left in too long. Next is the cervical cap. A cervical cap is a little cap made from soft silicone in shape like a sailor's hat. You put it deep inside your vagina to cover your cervix. The advantages of the cervical cap is unlike the diaphragm, the cervical cap protects against pregnancy for 2 days or 48 hours and for multiple acts of intercourse within that time frame. When placed appropriately, the cervical cap is often not felt by either partner during sexual intercourse. While the disadvantage of the cervical cap is it can be used as a barrier method of contraception but should always be used with spermicide. The cervical cap does not protect against STIs. You should not use the cervical cap when you have any kind of cervical bleeding, example your period, as it could increase your risk of toxic shock syndrome. But possible side effects of the cervical cap may include the following: from the spermicide, irritation of the vagina and surrounding skin or an allergic reaction. Strong odors or vaginal discharge if the cap is left in too long. An allergic reaction to the material in the cap, this is rare. Changes in the cervix because of irritations. These are the possible side effects of the cervical cap. Next is a male condom. Male condom is worn on the penis. It is usually made of latex, a type of rubber but some are made of materials that are safe for people with latex. The advantage of using male condom is it prevents pregnancy. The first and most obvious benefit of condoms is that it is a highly effective means of preventing pregnancy. It also These condoms is also are cheap and convenient. Condoms are sexy, effective against STDs, no permanent fertility changes, latex allergy, and condoms are not foolproof. While the disadvantage of male condoms is some people are embarrassed to use condoms or feel they may interrupt foreplay or intercourse. It also Both partners must be comfortable with using a condom and be prepared to use one every time they have sex. Condoms may decrease sexual sensation, and some people are allergic to latex or rubber. Condoms have no side effects, but rarely latex or rubber condoms can cause irritation for people with latex allergies or sensitivities. And sometimes, the lube on certain types of condoms may be irritating. If you are allergic to latex, try switching brands or using plastic condoms. Next is the female condom. Female condom are a barrier method of contraception, worn inside the vagina. They prevent pregnancy by stopping sperm meeting an egg. A female condom can be put into the vagina before sex, but make sure the penis does not come into contact with the vagina before the condom has been put on it. The advantage of female condoms is it helps to protect both partners from STIs, including HIV. When used correctly, they are a reliable method of preventing pregnancy. It's a form of contraception you need only to use when you have sex. There are no serious side effects. But the disadvantage of this is one of the main downsides is that they have fail a rate of 21% compared to a 13% failure rate for male condoms. But the higher fail rate could be because people don't use female condoms regularly for consistent protection. The common side effects of female condom is they can slip out of place during sex, they can irritate you or your partner's skin, they might make the sensation of sex less intense, and they're slightly less effective at preventing pregnancy and STIs than male condoms. And last one for this artificial method is the surgical methods of contraception. Surgical procedures for family planning include tubal ligation for female sterilization and vasectomy for male sterilization. Before either are performed, potential recipients should be carefully selected and counseled. The advantage of surgical sterilization or tubal ligation is it is very effective and permanent method of contraception. It also does not affect sex drive. It doesn't interfere with spontaneity of sexual intercourse, and there is no effect on your normal hormonal rhythms or periods. There is a risk, albeit low, of surgical complications such as internal bleeding, infection or damage to other organs. If the procedure fails and pregnancy occurs, this is rare. Then let's proceed to the other methods of contraceptives, which is the natural methods. Natural methods are the following: the abstinence, the calendar method, basal body temperature, cervical mucus method, symptothermal method, ovulation detection, and coitus interruptus. Abstinence natural method. Abstinence is simply not having sexual intercourse. If you're abstinent, it means you've decided not to have sex. This includes vaginal, oral, and anal sex. Abstinence prevents pregnancy by not giving the opportunity for semen to enter the vagina. Abstinence has also advantages. Of course, because it can prevent pregnancy, prevent STDs, wait until they're ready for sexual relationship, wait to find the right partner, have fun with romantic partners without sexual involvement, and also, and the last, and also, and the most important is to focus on school, career, extracurricular activities, and etc. While the disadvantages of abstinence is you can experience shows that even people committed to abstinence may unexpectedly have sex and may not be prepared to protect themselves from pregnancy and STIs. Many people may find it difficult to maintain abstinence over the long term. While abstinence and intercourse are super effective ways to prevent pregnancy and STDs, avoiding sex can be hard for some people. And if you plan on being abstinent but end up having vaginal sex, pregnancy can happen if you don't use birth control. Abstinence also have negative effects. It is without regular intercourse, your vagina can tighten and its tissues can get thinner and be more likely to get injured, tear, or even bleed during sex. This can be so uncomfortable that women with these symptoms avoid having sex, which can make it worse. Next is the natural calendar method. The calendar method helps you predict your fertile days by tracking the length of your menstrual cycles over several months to create a fertility calendar. Thus, by calculating the midpoint of the cycle, women can also work out when they are potentially fertile. And when they are definitely infertile, sex can then be avoided or an alternative method of contraception used on the fertile days of the cycle. This is the advantage of the calendar method. The disadvantage or the biggest drawback is that it's not as effective in preventing pregnancy as other birth control methods. It requires you to be diligent in tracking and recording your cycle, and even then, it can be hard to be 100% sure what days you're fertile. Actually, there are no physical side effects in calendar method. You can use it to plan when you get pregnant. You have to keep a daily record of your fertility signals, such as your temperature and fluids coming from your cervix. It takes 3 to 6 menstrual monthly cycles to learn the method. Next is the basal body temperature method. A fertility awareness-based method is a type of natural family planning. Your basal body temperature is your temperature when you're fully at rest. Ovulation may cause a slight increase in basal body temperature. The advantage of the basal body temperature is it can be used as a way to predict fertility or as a part of a method of contraception by helping you gauge the best days to have or avoid unprotected sex. Tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effects. While the disadvantage of this basal body temperature method is it may not accurately predict ovulation in all women, including those with irregular menstrual cycle. It offers no protection from sexual transmitted diseases. Sometimes this method is not effective in preventing pregnancy due to outside factors that can affect basal body temperature. For the side effects of this basal body temperature, it is not physically, but tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effects. Some women may choose to use the basal body temperature methods for religious reasons. Next is the cervical mucus method is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Tracking your cervical mucus for either fertility or contraception is inexpensive and doesn't have any side effects. Some women choose to use the cervical mucus method for religious reasons. Advantages and disadvantages of cervical mucus method. The cervical mucus method is good for determining when you're fertile by using your vaginal discharge as a way to determine where you are in your cycle. One disadvantage is that this method is not always easy to learn without the guidance of your OB or GYN or doctor. The cervical mucus method is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Tracking your cervical mucus for either fertility or contraception is inexpensive and doesn't have any side effects. Cervical mucus method side effects is also not physical, but some women may choose to use the cervical mucus method for religious reasons. Next is the symptothermal method, a fertility awareness method used to predict when a woman might be fertile. The method uses body temperature and other signs and symptoms of ovulation. Advantages and disadvantages of symptothermal method. The symptothermal method has a significant advantage in effectiveness because it combines the calendar, cervical mucus, and temperature methods. However, this technique shares the same disadvantage that each of these techniques has individually. Both of these methods are associated with side effects, particularly in combination with other medications, and tobacco and health complications, including mood changes, acne, headaches, breast tenderness, pelvic pain, excessive bleeding, amenorrhea, nausea, weight gain, and uncommonly blood clots. Next is ovulation method. Ovulation detection method. There are several ways to detect ovulation, including urine test kits to measure LH levels, transvaginal ultrasound, endometrial biopsy, blood test to measure hormone levels, and the basal body temperature. Advantages of ovulation. Ovulation test kits may be beneficial if you have slightly irregular periods or find other methods of tracking your fertility difficult or unreliable. Disadvantages. The disadvantages of it is ovulation test kits can be expensive and there are no guarantees. The side effect of ovulation detection method
was all for this day.
is
Thank you.
because
and
the
God bless everyone.
oocyte dies shortly after ovulation. Methods that correlate to progesterone and its effect identify fertility window closure. Next is coitus interruptus method. Coitus interruptus method, also known as withdrawal, is a traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. The advantage of coitus interruptus. Some benefits of coitus interruptus are that the method, if used correctly, does not affect breastfeeding and is always available for primary use or used as a backup method. In addition, coitus interruptus involves no economic cost or use of chemicals and has no directly associated health risks. While the disadvantage of it is it doesn't offer protection from sexually transmitted infections. Some couples also feels that the withdrawal method disrupts sexual pleasures. The pull-out method has no side effects, but the pull-out method is safe because it doesn't have any side effects. But pulling out won't protect you from getting an STD, and it's not the most effective way to prevent pregnancy.